we really got to get folks to question things and then be able to go back and say, you know what, let me look that on my own, look that up, and find credible resources so they can educate themselves. I think we've got to see an investment in science and that understanding of science because let's face it, it's not everyone's favorite topic, probably like math. But math is a little bit harder to dispute. 2 + 2 is 4. I don't think I recall many folks arguing that with me, but in terms of whether or not vaccines are safe and how they're made, for sure had a lot of conversations around.
Hi, everybody. This is Chris. And, what time is it, Al?
For another Readiness Rewired healthcare preparedness podcast, Chris.
Awesome. And Mike, are you on?
I am on.
And I think you've got a special guest for us, so take it away, Mike.
All right. Well, hello, everybody. Today's a momentous day at the Readiness Rewired studio. We've got our first guest, and boy, we picked a doozy. Sam here is joining us from public health. Now, one of the things we want to make sure everybody understands is that this is a healthcare preparedness podcast. Yeah, we're hospital folks, but healthcare encompasses a lot of different facets, right? And one of the most common facets that we in hospital preparedness work with is our local public health. And I've had the privilege of working with Sam here a number of years as our sort of lead contact at local public health. Sam is, he's about a dozen years of this into local public health. He has a background in emergency preparedness, specialized training in it, and and a master's prepared person in public health. So really a great guy to get to work with. And I don't know what we would have done without him over these past few years. Yeah, so when COVID-19 was starting to spread across the country in January 2020 and February of 2020, my boss, the CEO, came to me and said, all right, Mike, we need to face the employees. We have 15,000 employees. We're going to put you up in front of them at a forum. We're going to get our hospital epidemiologist, and then you can pick whoever you want. Who'd I call? Who are you going to call? Sam at Public Health. And so the three of us sat in front of our staff and answered questions. And I don't know what I would have done without Sam being here. So Sam, welcome to the podcast, brother.
Yeah, hey, thanks for having me. It's good to see all of you. I've got the pleasure to work with all of you in various capacities the past several years, and happy to share thoughts and feelings on all things healthcare preparedness.
Sam, you were an invaluable asset, teaching me a lot about public health's response in COVID, some of the novel ways you guys were gearing things up in your county. But since then, as COVID wound down, it sounds like public health, at least in the Midwest and particularly in our state, is maybe on a different path, maybe from, can you fill us in a little bit about what's going on with public health and particularly preparedness?
Yeah, absolutely. It's probably no surprise to anyone that given the past couple of years throughout the pandemic, public health got a pretty bad beating. We started out understaffed, underfunded, had a monumental task before us to do contact tracing and case investigation, and then quickly shift into vaccine planning and allocation. So it's been a rough couple of years. During that time, and since then, ourselves and so many other health departments across the state and even nation have seen a lot of turnover. We've seen a lot of institutional knowledge loss from retirees, early retirees, and management leaving the field. And so we're left pretty hurt and pretty bad trying to fill those gaps. And so there's a lot of work that we have to do in-house on ourselves and our workforce. But the other side of this is also looking at the changes across the state and nation to our profession. Particularly in our area, we're looking at having public health aligned with other programs across the state. And so it's got a few of us concerned on what that looks like, because as we know, those are massive changes to how we deliver programs and services. That also ultimately impacts grant funding, training our workforce, and really the what's at top of mind is that geographic coverage. Are we going to be within our county? Are we going to be in a district or region? And how much square mileage is that to cover?
Yeah, man. And just, I want to throw something in here too. When you said you guys have taken a beating, I mean, literally, people during the pandemic who work in local public health have faced threats and that sort of thing against them and their families. Isn't that true?
It has, absolutely. I think in the beginning and then going into vaccine planning was the height of it. But can share, obviously anonymously, but elected officials, other union reps, companies, or CEOs of other companies in our area had some pretty tough phone calls. Some I'll characterize as from unfriendly to very threatening at different times. And so it's been tough. Our team has taken a lot of those. I know that during contact tracing and case investigation, you're delivering likely not great news to folks and wanting to provide
No.
information and hopefully the actions that they can take to protect others. But folks aren't too happy about it, especially when you're asking them to stay home for a period of time. And the public was very upset, rightfully so. This is beyond an inconvenience to their life. It affects their livelihood and so many other things. And when it goes on for months to years, people get tired of it. So it's been a rough stint, but certainly we've leaned on each other for support. I've leaned on all of you for support as well throughout the past several years. And so that's what has really helped for myself get through a lot of this.
And Sam, your agency, as it's envisioned in different counties and locales, maybe it doesn't have quite the same staffing and maybe brain power. So it's kind of a lead follow kind of model where the lead agency is typically the state, and then it's providing direction to the local folks, or the local folks are waiting for that direction. And clearly with COVID, it was also involving the federal government, CDC, and the information changed, or sometimes it just wasn't coming out very, very quickly. Is anything changed in that arena where either you have more autonomy or roles and responsibilities are changed? What's going on in terms of lessons learned?
For the things that you pointed out in terms of communication, I can say that it's changed to some degree. There's less of a sense of urgency, which is nice. When things are urgent and information changes, maybe sometimes it's a direct pivot. That's frustrating and that's tough, especially as you all know, working in larger agencies, moving an entire agency and workforce, that's a big pivot. And so it's been quite tough. I would say throughout the past several months, it's gotten a lot better, but there's still some gaps. We can definitely see better communication, especially when it comes to changes to our profession across the state. When we're looking at districts and regions and what that will mean for our workforce and funding. I think in other terms of what has improved or those lessons learned are in terms of operations. Sometimes thinking outside the box and accomplishing some of those best practices from out of state are the route to go. Oftentimes, if you're not able to find the answer right next door all the time or within the state, to look elsewhere. Because likely, especially during a pandemic, everyone's faced with the same issue. Someone's thought of something, and so reach out to them and find those folks. So we feel pretty fortunate with the support we have here, but it was not uncommon to look at other larger states that don't look like our area, but they're bigger and they've got resources similarly, or they've got other folks who have similar thoughts. And so we all often look towards other urban and metro areas to see what they're doing. Most folks in our field have open playbooks. People want to share, they want to make sure that everyone else is doing the best that they can. And so that's also helpful.
You know, what you said, Sam, is that you guys are working to try to do the best you can. That's the real sad part about what you folks have experienced over the last few years. You know what my experience, and you guys can chime in on your experiences, but the people who work in public health have really one mission in mind, and that's the health and well-being of the community they serve. That these people care. Oh my God, they're caring individuals. Sam talks about, well, when we were kind of offline, he was looking at perhaps getting into clinical care and getting into medicine. a public health professional is no different than a clinician in my mind, because they have the public's well-being as a community in mind, right? And here they took the brunt of so much grief and anger from the public because of the job they were trying to do. I can't imagine Sam having to be one of the guys calling up somebody and saying, "Hey, man, looks like you got a positive test. You got to stay home." And that could have environmental, financial, familial impacts on these people. And who do they take it out on? Don't shoot the messenger. I think, unfortunately, that is actually what happened. And it went on for so long that people get so frustrated, people's anger turns towards the officials. And that's just so unfortunate and so unfair, especially given the general caring nature of these professionals.
Well, Mike, you bring up a good point, and I was going to follow up with Sam, and it leads into, because I heard something recently talking about, we try to focus on hospitals, and Sam comes from the public health, and I heard a statement recently: if one person is sick, that's the hospital. If the entire community is sick, that's public health. And I think that kind of sums up how the hospital and public health kind of come together with what Sam's talking about and everything, um, in all of us doing our role for the community. So, Sam, can you talk a little bit about FEP grants, public health emergency preparedness grants, and maybe some um, public health funding? What's been done to enhance that, or maybe what is the use that has been helping the community?
That's a great question, and that's one of the things that certainly we'll have to be continuing to monitor going forward in the future. But specifically for the PHEP or FEP grant, certainly those dollars are spent and allocated from the CDC. I believe it's still on a population-based formula for every county and district. And really, it's up to them to work with their partners, one on what their risks are and what their training needs are. And so that's been a funding source that has been something that public health has depended on for decades. We've seen some really amazing changes from being plan specific to all hazards approach to FEP capabilities that are standardized across the board. So if we're talking communication or information sharing here where we're at or across the state or in another state, it's substantially similar. And those investments into the tools that we use to help do that is also substantially similar. So those funding sources have been really helpful. So we hope that we continue to see either level funding or increases in funding in that. I think right now there are concerns given the recent federal budget deadlines that have come and gone, and whether or not the Pandemic All Hazards Preparedness Act can continue to get reauthorized and funded. So those are things that on a national level we hope to see get resolved, but it really does affect us at state and local levels. It'd be great to see an increase in that funding. It'd be really great to see an increase in that funding dedicated to staffing, because often those dollars get stretched pretty far. And for smaller shops that have maybe 3 or 4 folks wearing multiple hats, it's only a portion of their time, which is great. That's great flexibility. But as you all know, sometimes this work is not just a couple hours here, a couple hours there kind of type of job. It takes a lot of dedication. While we're talking about maybe the very rare thing that might happen, it's when it happens, it's game time, and you need people trained, you need people ready to respond.
So that public health emergency preparedness grant, that FEP grant, I think they reissue that in concept every 5 years with some goals, and I believe this is the year, if not maybe next year, that they're reissuing it. So not only funding, but kind of direction. Are you hearing anything federally or amongst some of those other contacts you have in other states about what direction, what priorities the federal government's looking at?
We have not, and that's been, I'll say, one of the frustrating things at the local level where we'd love to hear more. Certainly, we recognize there are other priorities and many things that our state partners are working on, but having that insight is really helpful. I think it also helps provide that direct tie from federal to local that we hope that the state continues to value as being that connection for us. So I wish I had more insight to tell you on that, but I hope that as always, it's favorable to us at the local level because we're really the boots on the ground. They want us to continue to make those connections to communities, build that trust, build that training and exercising plans so that we're ready. Um, that's really what needs to happen.
Awesome. And Sam, could you, just off the top of your head, what are some of the, since a lot of healthcare organizations and organizations in general need to come up with hazards and vulnerabilities assessments about, what are the most likely and what are the most consequential hazards they have to be concerned with? What are you seeing and dealing with in your area and maybe in the region for highest priorities for public health?
For our area, as always, the things that are most common and devastating should always be at top of mind. Uh, for us in this area in the Midwest, natural hazards are always top of mind, and so those can't be. We can't lose sight of those. But there are a lot of other things that are creeping up that could exacerbate that situation. And for us, and for myself particularly, I think of cybersecurity being a large issue. So many of our things are electronic and digital now. It's frustrating not to be able to have your password work. Can you imagine the whole entire system going down? And that's something that's out of your control. And so I think a lot more can be done for that on our side, across business sectors and otherwise. The other thing is the impact of climate change and really severe weather and the vector-borne diseases that would likely follow that. As we see that change, we're going to see probably a frequency in natural hazards potentially, and so that's a lot more things to respond to in 365 days. And so you're going to look at your workforce likely getting tired or maybe burn out quicker. The other thing is concurrent issues. During the pandemic that lasted over 3 years, in our area, we saw something called a derecho. We had blizzards still. And so having natural disasters on top of disease outbreaks and otherwise, it's a lot to juggle. And so we really got to have a mindset of being able to juggle those probably more frequently.
Boy,
Excellent.
you bring up a great point there, Sam. Natural hazards. I was talking yesterday with a roofing contractor, and he was based out of Colorado or whatever, because I want to put a new roof on my house. And I'm like, hey, dude, okay, you need to worry about this and worry about that. He goes, yeah, you guys over there in the Midwest, you have to worry about tornadoes and stuff. And I go, yeah, well, the worst thing we've dealt with are things like derechos. He'd never heard of it before. It's like, dude, you're in this business and you've never heard of a derecho? It's an inland hurricane. And, and he goes, all right. So I tried to educate him about it because, us in the emergency preparedness world, we spend a lot of time with the National Weather Service folks. We learn a lot from those guys and gals. And, they've been talking for years about how the climate is changing. I'm sorry, people. This is not a fallacy. It is frickin' changing, and there's no way around it. The science backs it up. And so what Sam's talking about is we're going to see more stuff, and the stuff is going to be more severe. And then you put the infectious disease stuff that's out there, and we can talk about that here in a little bit. Boy, preparedness. This is an intense science and profession that got to stay on top of, and you got to be on your toes and doing the work.
So, Sam, what kind of stuff are you working on that are kind of the top of mind projects? In your area, you have a CERT team, I think, and you've got a lot of kind of innovative work that you've been involved with as a public health professional and leader. So, can you enlighten us on some of the stuff that you guys are working on?
Yeah, absolutely. We're pretty fortunate. We've got a pretty large volunteer base, but that's another thing that we've seen change from the pandemic of just volunteer fatigue and not placing blame on anyone. People are tired. They've been working real hard. People are working hard just to get their lives back to new normal and settle from all the things that are going on, given from pandemics, natural hazards, your day to day. We've seen a significant downturn and change in the workforce across a lot of sectors. So always working on volunteer management. That'll be key because certainly there'll be more work anticipated during disasters and emergencies than there are hands. And so being able to have a steady and ready volunteer force will always be important for us. I'll say one of the really exciting things that we're working on here is really could be dovetailed in a recovery piece. for a lot of us in public health, we've done health assessments where we're looking at addressing priorities using data, primary or secondary, to identify what's the largest health priorities in our community. You can imagine the benchmark of we'll say December 2019, and then going forward, whatever your priorities were, I would bet money they got worse. I can bet money
Yeah,
that most
no
things got
shit.
worse. So
Absolutely. 2019 was the last normal year we've had in a while.
yep. So there's
Normal.
we've got a
Normal.
lot of work ahead of
Yeah.
us. So it's recovery mode. It's recovery and really team building mode right now. But we've got folks working on what is sort of a buzz term, but many of you probably have come across it and seen it, but community health workers. And so that's been a lot of exciting work of building a workforce that isn't necessarily laypersons. And really, what we're hoping is that they're a jack of all trades to support our communities, especially those who are really impacted by social determinants of health or other barriers to care, whether it's healthcare, food security, or otherwise, where they can help them navigate our really complex systems. I think that there's a lot to be said that those systems for support could be a little bit simpler and easier to navigate, but recognize that obviously federal funding has to have some data to track and quantify those things, but it's difficult. It's tough to get through, and so we're looking at building a workforce to help people do that. Much of this work is already going on in our communities. They may not be known by community health workers, but care coordinators, social workers, what have you, home aides. These are folks with skills and knowledge to help navigate a pretty complex system. And you can imagine that if you have trouble with transportation, you probably have trouble with healthcare too. If you don't have insurance, you probably have trouble with other things too. And so we're seeing comorbidities, co-occurring issues, just like we're talking about with disasters on top of other disasters. And it makes it real complex to address.
You're building this volunteer team. It's sort of a network. Are you providing training to them too, or you're just creating kind of a database of field staff potentially that you can pull together to tackle some of these problems?
Right now, we're building a coalition of workers that are already in existence. And what we want to do is be able to provide them the support for the existing work that they're doing. And so we're actually looking at funding now to help build more of a robust training plan. Our ultimate goal and what we hope to do is actually have a team of these folks employed at our agency that we work with. We've worked with a few other agencies that have provided us, we'll say, formulas, a plan to be able to look at return on investment so we can continue to demonstrate how valuable this work is. So right now we're past planning mode. We're looking at implementation, but it's going to be a stair-step process to really make the case before we ask for more funding. Certainly that comes at tax dollars or otherwise.
And with that, you talk about the community building and all the things you're doing within the community. I think a lot of us are also curious, what kind of reach do you have with the surrounding counties and communities of public health? And is there much collaboration? I know you're connected up to the state and everybody has a line to the state, but is there more of a web that you're talking with the next county over and the public health here and the public health to kind of find best practices or get some more ideas? What's happening in that realm?
Absolutely. That's really one of the great lessons learned from the pandemic that we had. I say had for a reason because we've seen turnover. And so as we've seen turnover and folks leave agencies, we've lost those connections to some degree. So we've got to work on rebuilding those. But
Okay.
when that's in its prime, when that's in existence, it's absolutely of value. Being able to reach over to the partner next door or the next county over and ask, hey, what are you seeing? What do you think about this? Has been invaluable. So as time goes on, it's on us to also reestablish those connections.
Hey, Sam, how do you bring in not you particularly, but, is there in public health, is there a way to orient, mentor, or onboard new public health professionals as they either transition from another job or are just graduating and trying to get into public health? How does the system manage those folks?
That's an interesting thought. We just got done working on a few things like that, and so I'll say our agency and a couple other larger agencies, we're working with our local university on how we can do a better job at we'll say the new workforce to attract them and want them to stay within the public health space, particularly at the local government level or even within the community level. And so that's been a difficult hurdle because folks often want to leave where they live and grow up for a time to explore the world, and that makes sense. But we're hoping to make sure that we remain an attractive profession. On the other hand, for other folks who are already in this space, as an agency, we've worked on better onboarding and training plans. Yet to be seen of how effective those are, but we're making really great progress to make sure that we're skill building and making sure that skills are transferable. I know the things that are on deck for us is looking at cross training, which for those who are doing a lot of business continuity planning, know a lot about that. And then certainly looking at continuity planning. So if someone were to leave suddenly, which we've seen quite a bit of that, there's at least some plans in place to get them caught up to speed so they're not drinking from a fire hose.
So somewhere you've got a SAM succession plan. You haven't revealed to your employer yet.
Working on it.
Yeah.
That's the rainy day, right? Or the parachute.
Yeah. What could you just give us an informal guess about how many people left public health in our, either, I don't know if there's national statistics, but certainly in our area, what would you guess percentage wise would be a turnover?
Oh, I can give you those numbers. I believe that they've got those published now.
Why am I not surprised? He knows these numbers. Of course he knows these numbers. I love it.
One of the taglines right at the beginning of the pandemic, we were already 80,000 professionals short across the nation because of the funding cuts that we've seen across a lot of public health programs. I believe at this point are projected within mid-year, I want to say it's roughly 50% turnover in the entire profession,
Wow.
which is dramatic.
Wow.
I can't remember exactly how many thousands they're estimating, but I know that if we continue to see this rate trend, we're seeing, close to 50 to 75 more percent of that increasing to 75%. So we've got a lot of work ahead of us, and we really need to. I mean, let's be honest, it's like hemorrhaging, and we're not just hemorrhaging people; we're hemorrhaging knowledge loss, and so that's something that we've got to combat.
Well, if you're interested in retired people, I know that you'd have to lower the bar quite a bit, but there are some retirees around. Al, in particular, I know could always use a spare job.
That bar has to be way, way lower, buddy. Come on.
Hey, Sam, I'm going to bring something up because this discussion just struck a nerve. One of the reasons I retired when I did had to do with some of the fallout from COVID-19, just burnout and things like that. But I have to be honest with you. The politics of it really got to me. And so, we've kind of alluded to the fact that you folks in public health took a beating because you were unfortunately on the firing line with the public as the impacts of the pandemic and hitting home with people. You folks were right there in front of them, oftentimes giving them the information. Here's the bad news. Here's what you need to do to try to keep yourself safe, keep others safe, etc. And I think back, I was in preparedness about 13 years, a little bit more. Went through H1N1, and that was the most intense thing I had gone through in the early part of my career. And H1N1 had nowhere near the impact on all of us and society that COVID did. I think the stats are something like 284,000 people U.S. residents may have died from H1N1. I think there's a range. They don't have an exact number. It could be up to 500,000 or so. Where here let's take COVID, for example, since we're talking about it, 1,176,639 deaths was the last number I saw. All right. That's a lot of deaths. Now, there's people out there saying that's bullshit. It's the government making it up, blah, blah, blah. And that's the unfortunate piece of all of this. I did not experience any of this controversy, this kind of stuff surrounding COVID back during H1N1. H1N1, it was like when the vaccine was finally out under the old technology of, protein-based vaccines. Literally, when you folks at Public Health took a delivery on the little bit of vaccine that was allocated to the county, for example, I get a phone call from you folks. The vaccine came to me in emergency management at the medical center, and it got to the point where we were getting such small amounts, and there was such a huge demand for H1N1 vaccine from the public that they wanted to give me armed security because they were afraid somebody was going to roll us, when we were doing this vaccine delivery exchange and whatnot. Contrast that to what we've experienced during COVID-19. Where do you think this come from? Why did we see such a great difference between then and now? And how are we going to prevent that in the future? Because let's face it, everybody knows there's going to be another pandemic. It's not a matter of if, it's a matter of when.
Yeah, Mike, there's probably a lot of thoughts around that, but I'll share mine particularly. I think it starts at the top of how the information is shared and gets to the public and how the conversation can be framed. I think from the get-go for COVID-19, it could have been framed a lot better, and there could have been a lot more um, consistency going forward. I think, unfortunately, regardless of political party or anything else, a lot of folks are more divisive on things. Folks aren't willing to have the conversation or discourse, and in a way that they're wanting to come in good faith to talk about it. I think we're lacking that as a community, as a society, and I think that made a huge impact because folks wanted to pick a side, and well, if your side's wrong or right, folks probably weren't coming at it in a manner that helped get folks to center to at least understand. And so when you get that stress on top of more stress of really a really horrible disease, it really exacerbated things. And so I don't think there was ever a time where folks could say, "Hey, let's pause and let's talk about this. Let's pause and resolve." There wasn't any time for that, and so as you know, we had to move pretty quickly, constantly, and for so long, and so really, it really stacked on top of each other. So in the future, what we can do about that, I'm not sure. I think we've got
Yeah.
a lot to figure out before that happens.
I mean, it seems to me that, okay, a vaccine is to lessen the effects or to prevent a particular disease. It almost seems like we need to do some sort of information vaccination to society ahead of time on these things, and somehow control people's reaction to hearing the news and say, hey, look, you're probably going to hear a bunch of misinformation. You're going to probably hear a bunch of crap that people are making up about this. But when you hear it, here's what you need to think about, and here's the truth. And what's so interesting to me is, and why I try to emphasize why public health professionals like you have only one thing in mind. It's not politics. It's not any personal gain. People in public health just care about the community and the community's general well-being. When they speak, people should listen, and unfortunately, that message somehow got twisted and altered down the road. And trying to figure out a way to dissuade that from happening during the next pandemic, I think is going to be a big piece of it.
Like, I think you're definitely onto something about that information inoculation. We really got to get folks to question things and then be able to go back and say, you know what, let me look that on my own, look that up, and find credible resources so they can educate themselves. I think we've got to see an investment in science and that understanding of science because let's face it, it's not everyone's favorite topic, probably like math. But math is a little bit harder to dispute. 2 + 2 is 4. I don't think I recall many folks arguing that with me, but in terms of whether or not vaccines are safe and how they're made, for sure had a lot of conversations around that topic.
Yeah, don't you think though some of this is and Mike, the novelty of this particular pandemic, there was a lot of shifting initially and a lot of uncertainty that we just didn't have enough science and enough research to be able to say this is what you need to do or this is. So people were starting to look at early information and making judgments and then not moving from those judgments, even if the science shifted or the information, the quantity of information. So part of it is a public literacy, not a literacy of not just science, but math and statistics and just also being able to manage uncertainty that we don't know yet. Stand by with with what we know, this is where we're at. So, Sam, I don't know if you've gone back. I know that there's actually something that was published by, I think, one of the universities here in the Midwest, but, going back and comparing the Spanish flu with COVID and the early outbreaks, and then the public reaction, the quarantining and the response to quarantining and all. There's some real interesting comparisons, some eerie comparisons. And I'd also, I'll turn it over to you to comment on, but I do want to also include that if you go back to the statistics here in our state of 10,000 folks dead, in excess of 10,000, that actually exceeds what the number of deaths in Spanish flu. And also, by the way, if you were to take both world wars and the Korean conflict and the number of citizens that died, it exceeds the numbers there. So I'm not sure that we've even gotten our hands around the magnitude of what's happened to us. And people with the amount of information have already kind of headed off in another direction and not realized the devastations, and not to mention long COVID, right? And the long-term healthcare consequences. So anyway, back to you.
Yeah, Chris, absolutely. I think during probably we'll say midway the first year of the pandemic, we had some really great colleagues across public health and historians that began to share a lot of that information just so folks could help conceptualize what was happening and really try to benchmark it off something. And fondly remember seeing some pictures of, we'll say, the Anti-Masking League and other folks who were just really against the regulations at that time. I think the difference between then and now is the speed of information, and where folks could really see that, we'll say, vitriol or maybe that resistance. Say, yeah, I agree with that, and they would do the same thing. I think the only funny thing that came out of that were protesting gym closures at that time, where folks were protesting by doing push-ups outside. And I thought, well, you're kind of proving their point that you don't need to be in a building, but that's great. That's your right to. It looks a little silly, but absolutely understand where you're coming from. It's a frustrating situation, but you're sort of proving the point that you can exercise without the gym by doing push-ups outside.
Al does push-ups outside all the time. Yeah, I've heard of that.
Wow, are you talking a different Al?
God, we could go on and on about this. I want to touch on once on vaccine. I mean, geez. You made some good points about how information changes. Chris mentioned it, and you emphasized it. When something novel like this happens, the novel influenzas or highly pathogenic avian influenzas that are circulating out there. By the way, I was part of that network in the country that watches for things, and one of the most respected docs that I know involved in all of this nationally. I asked him one day back in April when I was visiting their medical center. I said, dude, what do you think the next thing is? What are we going to get hit with next? What do we need to be ready for? He looks at me and he says, the coronavirus variant was not something that was so much on our radar when it hit. But this one, he's thinking it's going to be a highly pathogenic avian influenza. H1N1 was an avian influenza that infected a pig. That's why it would call swine flu. We could go into how the pig is the mixing bowl and how it can get a human virus and a avian or bird virus at the same time, and then you get this mutation, and that was H1N1. Okay. He thinks it's going to be something like that. It's going to be another airborne, highly pathogenic avian influenza, something like H5N1 or some variant or something like that. And it's like, okay, how do you mount a response to that quick enough to save lives? Well, if you look at some of the statistics, without the mRNA vaccine platform, which, by the way, was not brand new, I knew the folks who were working on it back a decade before 2019, 2020. So this is not something that was that new. It was a platform being worked on, and it was being tested and successfully tested, and it was quickly engineered to meet the genetic requirements of trying to be a vaccine against COVID. Bottom line is, without that tool to come in as quickly as it did, far more people would have died and far more people would have been infected. And so, unfortunately, the misinformation that's out there against vaccines and this particular platform really have cost people's lives. Wouldn't you agree?
Absolutely. The fact that that tool and that technology is not more celebrated is a shame. Because when we see these things on the horizon, and Mike absolutely am worried about avian flu. When we see, and we just mentioned really the effects of climate change, if that changes migratory bird patterns, I think we'll see some curveballs. And so
You
that
betcha.
should absolutely needs to continue to be surveilled. But from ground zero to having a vaccine in hand, that technology speeds it up uh, demonstrably. And being able to get that in arms to save lives is so important. And you made a point about how science changes, and I think that's the one thing that folks either don't want to or it's hard to wrap their head around. In politics, they call it flip flopping. With science, that's just called looking at new evidence, and that's hard for people to understand and accept because it makes it feel like at some point you were wrong. And sure, you can look at it that way, or you can look at we've got new evidence, and this is how we're adapting to that. So that'll be a really key point to do for ourselves as a profession, but also to convey to the public to also be able to do that with us.
Absolutely. And I'll tell people, I was part of that first trial, phase 3 trial for the Pfizer vaccine. I was one of the 44,000 people worldwide that joined that trial. The reason would be is that if you look at the evidence that had been built up to that time, it looked very, very safe up to the start of the phase 3 trial. I'm not a complete fool. And we had experts right here in our facility that were working on this vaccine as well. And so it's like you make a rational decision. Look, this is looking good. Here's a platform that's been around for a decade. They were able to quickly modify it to encompass some of the genetic material of the virus, but not the whole virus. It's not the actual virus that's been inactivated. And it's not something that, had any little nanobots in it and you were going to be traced by the government after you got your vaccine. All the crap that came out after all that, just it's mind boggling. You can't fix stupid and you can't fix gullible. And unfortunately, there's a lot of gullible people out there. And without that tool and without it moving forward to the next pandemic, I cannot imagine how we would fight it without that kind of technological advantage that you can quickly pivot and respond to something brand new and novel. It's going to happen again. And this tool is going to be a major move forward to be able to deal with it.
Hey, Sam, we're going to be winding down here, at least for this episode, but we can't really leave the concept that you first started up with, and that's that preparedness is a team sport. What can hospitals, what can clinics, what can long-term care facilities and other healthcare providers and communities know and do to be better prepared and be partnered with public health? And I guess one thing that I've already learned from you is for those that work in the community, reach back to public health to be part of maybe that registry or that network that you're talking about. If not, encourage their public health folks to begin that process. But what else? And with all the things on your desk to do and requirements to meet, what anything to share that will help you and help them?
Yeah, absolutely. And actually, this is a huge tip of the cap to Mike. When I first moved here, I was introduced to Mike and immediately got a response back. It's like, yeah, happy to have you. Would love to have you over at our hospital. And invited me over to, I would say, multiple meetings. And I got to know Mike really well. That opening, inclusive, welcoming environment is absolutely crucial to our field. We're all on the same page. We're all on the same team, and be able to make those connections and build that trust and networking is really important. I think it was shortly after that Mike and I had each other's personal cell phones because
you
we
bet.
needed to get a hold of each other. It was urgent, and we knew that because it's related to our work.
Sam, shit is hitting the fan.
It was not uncommon to get a text from Mike after a meeting from the state or wanting to touch base on what's going on, and that's really helpful. Because those are the players in your backyard, and you want to know what they're thinking. You want to share what you're thinking. And Al and Chris, the amount of times an email is exchanged just to share thoughts and feelings on things is important. I think that's one thing that I feel is different here locally than other places I've worked. People don't do that as much, and so would absolutely encourage folks to fire off that email. Maybe if you're real angry, maybe pump the brakes and think about how you're saying something. But if you want to know thoughts and feelings from other professionals, get them out there. Reach out to folks and say, hey, what do you think about this? Or call out things that you don't like to see, because likely other folks feel the same way, and really build those networks to be able to have those conversations. They even have that discourse. I can imagine if we talk long enough, there are things that all of us wouldn't agree on, and there are things that we'd all agree on. But what's nice about this is having the trust to be able to do that. Because when it's going down, you really want to be able to trust the persons that you're working with. And so reaching out and building that network is probably the most crucial first step. After that, it's all the other things like funding, supplies, equipment, who's where, who's doing what, schedules. You can figure those things out. But it really revolves around trust.
Excellent. Excellent. Hey, Al, what time is it?
Hey, Chris, I think it's time to wrap up here for another session. Maybe one thing to wrap it up, Sam. Great information. And, we've always talked about in COVID, out of something bad, we found a lot of things. Out of something bad comes something good. What would you say, and you've hit on some topics already, but what would you kind of wrap it up with? What was the good that came out of COVID that we can take forward?
I think the biggest thing, at least especially in our area, is the power of partnerships. I would say for our area where we're at, we were able to do a lot of amazing things. We did typically, and it's not like this across the state and nation. We get a lot of support from our community. I mean, do we get a beating too? Sure, at times it was tough, but I think for the most part, meeting new folks across the table, strengthening the partnerships that you already have, and tying folks together into a network of folks who want to do the right thing to tackle the issue before them is pretty strong. And so I think out of all of it, have met a lot of folks. I've been on the phone or Zoom or otherwise with so many new folks I've met from the pandemic, and want to keep those relationships going. And so that's been an amazing experience, and really the silver lining from having a pandemic.
Excellent.
Well,
Thank you, Sam.
thanks for carrying the torch, Sam, because from 3 retired guys, we feel good when we see guys like you still in there fighting the daily battle, and that's very much appreciated, even though it's not often said.
Absolutely happy to do so.
And I'm going to throw it in too. You know what? Folks listening out there, if you work in emergency preparedness right now, make sure that you have a great relationship to your local SAM or whoever he or she is. People in public health care about one thing. I'm going to reiterate it again. They care about the health and well-being of the community. That's all they care about. Trust them, listen to what they say, support them, and don't give them a bunch of grief, because they're doing the job for everybody's well-being, and they should be highly praised and thanked for what they do.
Well said.
Thanks, everybody.